All right, thanks so much, Tracy. The dreaded trip to the dentist. Some despise getting work done on their teeth so much they'd rather be knocked out with sedatives than conscious for the procedures. Because health matters, dentist Steve Mangan is here this morning to talk about the risks and benefits of sedation dentistry. It seems like this is getting even more popular recently.
Sure is.
Is dental phobia a real thing?
Well, any phobia is real to the person who has it. So you gotta give them a little bit of props that, you know, some people come in to dental offices and they can get work done that would scare other people completely to death, and they do it with no sedation, with no fears whatsoever. But some people, whether it's justified or not in your mind, some people are just deathly afraid of dental care. And so as dentists, you know, we have to figure out what are we going to do about this, because some of these people need really extensive work.
Perhaps they've put off going to the dentist for years.
Especially if you're phobic. And so, you know, I look at my little registration form and I have a checkbox of do you have fears? And a lot of people put yes, but the truth is the people with severe fears, they don't even get my form and fill it out. They don't get on my website and log in because they're afraid to even consider it. But it is something that it doesn't make the problems go away. You know what I mean?
Right. So let's talk about what you can do. I mean, we've heard about laughing gas. That's the olden. Do we have laughing gas anymore?
Yes. Oh, yeah, absolutely.
Still
and you know what? For the people who have mild phobias, laughing gas can be great. If you're more afraid, if you're afraid to the point that that is not going to cut it for you, actually dentistry might be safer for you if you're more sedated. So there are oral sedatives that can be administered to.
So it's just a pill you would pop before going to the dentist.
That's right, and that pill can make most people really comfortable with dental care. In fact, we've done fairly extensive surgery on people who are alert enough to speak to me and to respond to what I need them to do, but completely comfortable with what we're doing.
Kind of out of it.
Out of it, just enough to be comfortable. And then you've got some folks, they go beyond that. They are terribly phobic, and really the only way that they're going to be able to comfortably get dental work done is if they're really put to sleep.
And the point is, you know, find what works for you, because the consequences of putting off dental care, there are tons, I mean,
the problems are going to get worse.
A list of consequences.
Infections, I mean, it goes on and on.
So something to look into and just ask your dentist about, and make that phone call. Go on the website, start looking around, make that first step.
If you're afraid of going to the dentist, don't put it off. Call and say, I need to have a consultation about sedation dentistry.
It's okay. It's okay to be a dental phobic. All right. Thanks a lot, Steve.